Good morning, Dr. Rossman. You look fine. Looks good.
Oh, Lisa did tell me about that.
Yeah.
I need a different office, Scott.
Thank you, Dr. Rossman. I just want to say good morning again, everyone. We got have more people coming on the line. If you are a member of the media, as we go through this chat, which we're going to keep, to no longer than 30 minutes, please feel free to use the chat function on WebEx to send me a message. You can just hit to just me if you have a question you would like to be called on at the end. We'll try to get through as many questions as we can. Good morning, everyone joining the call. We're going to start promptly at 12:30 in about 3 minutes. When you please mute your phone to make sure that we don't get any background noise or conversation. Also, as I remind everyone, if you're on WebEx, feel free to use the chat function and send me a note there or through a text message to my cell phone if you want me to call on you for a question. I will try to get through as many questions as I can today. If everyone could please put your phone on mute. Was just hearing some dialing right there. Just a reminder, everyone, to please put your phone on mute. Good morning, sir.
Morning.
Get started in here in a minute. All right, good morning, everybody. It is now 11:30, and we promptly start this media gaggle. I just want to thank you all for joining us. My name is Scott Peterson, Director of Communications. This morning, you're going to be hearing remarks from County Executive Ball, and also on the call will be Dr. Maura Rossman, our Health Officer, and Larry Tweel, who runs the Howard County Economic Development Authority. There are other County Executive Office staff members that are also on the call in case any questions come up that might be specific to their areas. Please, I remind everyone, and especially because we have television cameras recording, to mute your phones throughout this conversation. And if you have any questions for me, the best way to notify me that you have a question is through the chat function in WebEx, or you can text me at 202-277-9412 if you have any questions that you would like to direct for me to call on you. Without further ado, I would like to turn it over to County Executive Calvin Ball for opening remarks.
Thank you, Scott. Good morning, everyone. Thank you so much for being here. I appreciate your time and attention. The COVID-19 pandemic has forced our community, our state, and our nation to confront remarkable. Over the past 2 months, our residents, businesses, and organizations have helped us to significantly reduce the spread of this virus and save lives. We are incredibly grateful to our residents who have followed our guidance, stayed at home as much as possible, and did what they could to help keep people safe. In consultation with our health department, we took swift action. Within hours of learning the first confirmed case here in Howard County, we limited gatherings and was one of the first jurisdictions in the state to close our mall and our movie theaters. Additionally, we were one of the first drive-through testing sites in the state. And while we have made significant progress in increasing testing capacity, increasing our surge capacity, scaling up contact tracing, and stockpiling our PPE, the crisis is far from over, and we must be prepared for these operations to last. Since March 15th, 1,315 of our residents have tested positive for COVID-19, and that's as of 9 a.m. today. And sadly, we've lost 44 of our residents. And as I mentioned Wednesday night, we've only been able to test about 2% of our population, and that yielded an 18% positive. When Governor Hogan unveiled his Maryland Strong Roadmap for Recovery on April 24th, he outlined 4 building blocks that needed to be in place to open our state: personal protective equipment, surge capacity, contact tracing, and testing. Under HOCO Rise, our plan to reopen innovatively, safely, and effectively, we've been intently focused on strengthening these building blocks, and we've made progress. But there's still a lot of work to be done. And while we've increased our testing capacity, we are now testing approximately 1,300 people per week across all parameters. And that's up from our first day of about 30 people. However, we haven't reached our goal to test about 6,500 per week. And our hospital is prepared for a potential surge. However, our hospitalization rate has remained steady, not declined over the last 14 days straight. And we are ramping up the number of contact tracers on staff, but have not yet reached our goal of around 60. Through HOCO Rise, we are also using data to guide decision-making around reopening and, if necessary, when to maintain or bring back those restrictions. These data points include the number of new confirmed cases, the number of new hospitalizations, the number of patients admitted to our ICU, the number of tests conducted, the amount of available PPE, and the surge capacity at Howard County General Hospital. Along with the 4 building blocks, the governor's plan also outlined 3 phases for reopening. The first phase included activities deemed low risk by the governor, including limited outdoor religious gatherings, curbside pickup, retail, and reopening some small businesses. Understanding that not every county in Maryland is the same, he also talked about the need for local flexibility. When the governor announced the start of phase 1 on Wednesday, he went farther than previously laid out in his April plan, specifically by allowing indoor religious gatherings of up to 250 people and by reopening all retail. And while it is my desire to have every business in Howard County open and thriving as soon as possible, my first responsibility is always to the health and safety of our Howard County residents. And based upon the data indicators that we're tracking and in discussions with our health department, we have identified what we could responsibly reopen. Retail businesses may open for curbside pickup or delivery only. This includes all stores at the mall in Columbia and the shops at Savage Mill. The governor's order allowed for the reopening of retail businesses with restrictions such as allowing 50% capacity. But based upon the current situation in Howard County, we feel that those restrictions don't go far enough. Additionally, pet adoption centers, pet groomers, and car washes may have customers indoors, but only at 50% capacity. Religious gatherings may resume while adhering to the gathering guidance of 10 persons or less. This is a major departure from the state guidance, which allows indoor religious gatherings of up to 250 people. For us, barbershops and hair salons may open by appointment only and only allow 1 customer in at a time. The governor's guidance allows for salons and barbershops to open and operate at 50% capacity, which does not necessarily ensure physical distancing in areas like hair washing stations, where chairs are often very close together. Now, as allowed by the state, outdoor activities, including archery, shooting ranges, horse boarding, and riding facilities, may open with physical distancing and mask requirements. And manufacturing, many of which, as small businesses in Howard County, may open. Now, while Howard County is certainly not ready to fully reopen under the governor's phase 1, we are pleased to take these steps to begin safely reopening our economy. And while we will be watching our numbers and these benchmarks carefully to determine when we can continue to reopen, or in the unfortunate event of a surge in cases, if we need to bring some restrictions back. We recognize and understand the extraordinary circumstances our residents and businesses are facing due to these mitigation measures. Just yesterday, we saw an additional 3,199 residents file for unemployment, bringing our total in Howard County to more than 26,000. These are unprecedented times, and we understand the state is working around the clock to get Marylanders their payments. At the same time, we are working to provide relief and food and rental assistance. Last week, I announced $200,000 in relief funding for our Community Action Council. And beginning this week, they initiated an action plan to distribute 30,000 pounds of food to our residents in need. Our Howard County Public Schools have distributed more than 645,000 meals since schools closed in mid-March. And our community has rallied to support our neighbors and our friends in need. And as we move forward in the reopening and recovery process, it is clear that everyone will not be satisfied with all of our decisions. For some, we are moving too quickly, and for others, not fast enough. And as the governor moves through the phases of the Maryland Strong Roadmap to Recovery, we will work with our health officer to make wise decisions based on the safety of our community and use our HOCO RISE plan to take a phased approach to reopening government safely, following the recommendations of the internal HOCO RISE working group, provide guidance to non-governmental entities as needed, and use the HOCO RISE metrics to ensure the timeline laid out by Governor Hogan is appropriate for Howard County. We're confident our HOCO RISE plan will achieve the appropriate balance and ultimately not erase the progress we've already made through the sacrifices that we've done. Howard County will continue to make data-informed, people-driven decisions as this pandemic and circumstances change. We are a community, and we can only get through this when we all work together. Thank you.
Thank you, sir. And if you're just joining us or you join us late, please make sure to remind everyone to mute your phones. And now let's go to, we're going to go to Dr. Maura Rossman and then Larry Twill for just brief comments following the county executive. Dr. Maura Rossman, you want to go first?
Yes, thank you. Good afternoon. Howard County Health Department has been working in concert with Howard County government and County Executive Ball and his staff since this first began, even before March 15th, when we unfortunately had our first case. We have been talking about not only our response, but how we measure how our successes and how well we're doing in terms of our mitigation efforts. We are evidence-based, using data to determine our decisions, recognizing that this disease is novel, unknown, and that we will need to make course corrections based upon the epidemiology and the clinical aspects of this disease that we are learning about every day. This requires us to be patient, flexible, and nimble and adjust our recommendations. As County Executive Ball has pointed out, we are making progress, but we are not yet where we need to be to safely reopen. It is prudent to be cautious about our recovery efforts. We don't want to move too quickly in an effort that will undo our efforts and place our constituency at risk. We have moved successfully over the past few months, and we will continue to work with Howard County government, our community, Maryland Department of Health to gradually move forward and continue to monitor using data elements. Thank you.
Thank you, Dr. Rossman, and all the work that the health department is doing here in Howard County. Now, Larry Twill, and that's Twele. from the Howard County Economic Development Authority. Larry? Larry, you there? On mute.
Sorry about that. With over 84% of our businesses having fewer than 20 employees, we understand that the small businesses are the lifeblood of our community, and nobody more than the county executive and me want to see these businesses get back to business. But there is, we definitely don't want to get back too quickly and then have to retrench and take a step back. We are in constant communication with our business groups, our business community, and our business partners to make sure that they've got the information and are getting the resources and are working their way through this. But we need to be deliberate about how we get back to business. This phased approach with retail and the slow opening is that first step. That's the first phase. And one of Howard County's greatest assets has been our geography. And we are in the middle of the state, and we need to be cautious about how we proceed, and that we are being careful considering the surrounding jurisdictions. It is important that the county executive is working with these other jurisdictions and making sure that we are phasing our approach appropriately. It is painful for our businesses, but we are encouraging patience and making sure that we are getting slowly back to work.
Thank you, Larry, and thanks for all the great work and outreach that the EDA does with our business community. We're going to go to questions now, and please a reminder, if you have a question, probably send me a note in the chat or a text, and I will do my best to call on you. And remember to unmute your phone when I call you. The first question is going to go to Liz Ortiz with Fox 45 in Baltimore. Liz, please unmute your phone and ask your question.
Thank you, Scott. County Executive, on a warm day like today, some retailers may typically set up merchandise outside for curbside sales or shopping. What are your thoughts on that? And could this be something that is considered for some of these small retailers, especially as we head into early summer? Could curbside shopping be a thing?
I think that curbside shopping and online is definitely an option that they should consider, as long as they are able to implement physical distancing, wearing masks, and the appropriate sanitation. I think one of the challenges of the logistics, although many people want to open immediately, it's difficult to find the PPE. It's difficult to find the gowns and the hand sanitation to ensure that people are able to, in between each customer, do what they can to not only keep their workers safe, but the customers safe. However, I think that as we continue to evaluate these metrics, that is a great opportunity as far as curbside for people to not only get what they need, but ensure that our businesses are able to slowly reopen our economy.
Thanks, sir. The second question will go to Scott Ewert. Scott?
Thank you, Scott. County Executive All. The question I have is in relation to the data points related to HOCO rise. The data points you're using to inform your decision-making, those 6 data points of new cases, hospitalizations. Are you looking at state numbers, or are we looking at Howard County numbers as far as ICU and hospitalizations and those numbers?
I'm going to turn that over to Dr. Rossman.
Dr. Rossman, you there?
Yeah, thank you. I had trouble unmuting. Yeah, thank you for that question. So we're looking at both, the answer is, because as Larry Tweel mentioned, in terms of business, Howard County is not an island in terms of business and where we do business and crossing borders. Certainly our healthcare system is not isolated to Howard County General Hospital, that many of our community are hospitalized elsewhere. And in fact, Howard County General is part of a larger Johns Hopkins system and is moving patients between the Hopkins system to ensure that the beds are adequate throughout the state. So we are looking at all numbers, both state and locally, because we know we're not just our residents just don't go to Howard County General, that they are going across the state, and actually they go across into different states as well. Thank you.
Thank you, Dr. Rossman. Anna with the Howard County Times. Anna, Howard County Times, please unmute your phone. You have a question? All right, maybe there's a technical difficulty there. Is there any other questions from the media that we can answer? Those are the three that I was notified of. All right, it's just me. No one else is hearing anything, correct, sir?
I'm not hearing anything. I don't know if maybe my delivery was just so thorough and so good.
Wait. Anna's, I think, having some challenges. She is trying to get through. Let's give her a minute. Is there any other questions from anyone else in the media?
And this won't be the last we have these conversations.
Go ahead. I'm sorry, someone chimed in.
I was going to do a quick follow-up since we had a second. This is Scott again, Ewert. The number of tests conducted is not a metric put on the dashboard today. Is that something that may go on the dashboard, Dr. Rossman, in the future?
Yeah, so we're continuing to evaluate what goes on the dashboard, and app will make a consideration of that.
Okay, thank you.
Scott, can you hear me?
Yes, I'm glad you got in. Go ahead.
Okay, perfect. Thank you. Hi, County Executive. I've been speaking to small business owners all morning, and there's a lot of concern and quite frankly, fear out there for the survival of their businesses. They used to have months left on their, time span, and now they're dwindling down to weeks just because they haven't been able to open back up. And every single one of them wants to know what a timeline looks like. So I wonder, I know you've laid out your roadmap here, but once, there's 14 days of no consecutive rise, is that when we will see a reopening? What does the timeline look like? And then on top of that, I know you've compared Howard County a lot to surrounding jurisdictions and the trouble that we've seen in Montgomery County and PG County. Are you waiting to see a decrease in those counties as well, or for those counties to shut down before you lift some of the restrictions?
Great question. So there is a great deal of understandable fear, anxiety. Things are evolving very quickly, and I know that many of our businesses, including just our residents who aren't business owners, are very concerned about the instability. And unfortunately, although I wish that we could safely reopen every business, and every county executive and mayor wants to have a booming economy with low unemployment, we're going to put the health and safety and welfare of our residents first. And it is unwise to reopen too fast and irresponsibly to only potentially not only erase the gains that we've made, but potentially make things worse and unfortunately possibly lose more lives. So we are working with our various businesses. I speak regularly and frequently with entities like our Chamber of Commerce and our Economic Development Authority, and Visit Howard County have been working around the clock to do all that we can to support those businesses, to inform them and to empower them. Those, as Rossman indicated, that not only do we evaluate for Howard County, but for the state. Howard County is the largest of the small counties, and we are surrounded by other counties, including Montgomery County, Prince George's, and as was noted, we are the center of Baltimore and DC. And as we see, Prince George's, Montgomery, and Baltimore City have decided to issue stay-at-home orders, and we see even in DC and Virginia, they're not planning on opening up until early June. So I think we need to evaluate all of those things. As we see, there are many people that if we were to reopen too soon, we will have people from not only other jurisdictions,